Nourishing with care, safe medication. Choices for breastfeeding moms. Hey everyone, it's Dr. Mike and welcome back to my channel. Today, we're diving into a topic that's close to the hearts of many new moms, breastfeeding and medication. We all know that breastfeeding is like a superpower, passing on essential nutrients and antibodies to those adorable little ones. But what happens when mum needs to take medication? It's a common concern, and understandably so. In this video, we'll break down everything you need to know about medications and breastfeeding, empowering you to make informed decisions.
Now, before we get into specific medications, let's talk about how medications actually work in our bodies. When you take a medication, it goes on a little journey. We call it pharmacokinetics. You take a medication, it gets absorbed into your bloodstream, travels to different parts of your body, does its job, and then eventually gets eliminated. Some medications can actually make their way into breast milk. But don't worry, the amount that gets transferred is usually very small, and most medications are perfectly safe to take while breastfeeding. So, how exactly do medications end up in breast milk? It's all about something called the milk-blood barrier. Just like our brains have a special barrier to protect them, our breasts also have a barrier that helps filter out certain substances. But some medications can slip through this barrier, depending on factors like the medication's size, solubility, and how much is in your bloodstream.
Let's talk about some common medications that breastfeeding mums might need, starting with pain relievers. Acetaminophen, which you probably know as Tylenol, is generally considered safe for breastfeeding moms. It's effective in relieving pain and fever, and only tiny amounts get passed through breast milk. Of course, like with any medication, it's always best to use the lowest effective dose for the shortest amount of time necessary. Another pain reliever that gets the green light for breastfeeding mums is ibuprofen, also known as Advil or Motrin. Just like acetaminophen, ibuprofen is considered safe for breastfeeding mums when used as directed. It's a go-to for reducing inflammation and tackling pain and fever. Always opt for the lowest effective dose and consult with your doctor if you have any concerns.
While aspirin is an effective pain reliever, it's important to use it with caution while breastfeeding. Aspirin can linger in the body longer than other pain relievers, and there's a potential risk of a rare but serious condition called Reyes syndrome in infants. If you're looking for pain relief while breastfeeding, acetaminophen or ibuprofen are generally safer choices.
Penicillins, like amoxicillin, are among the most commonly prescribed antibiotics, and they're considered safe to use while breastfeeding. These antibiotics are effective against a wide range of bacterial infections, and the amount that passes into breast milk is minimal and unlikely to cause any harm to your baby. Cephalosporins are another group of antibiotics that are generally considered safe for breastfeeding moms. They work in a similar way to penicillins, targeting and fighting off bacteria. The amount of cephalosporins that make their way into breast milk is very small and unlikely to pose any risk to your little one. Macrolides, such as azithromycin or Azipac, are another option for treating bacterial infections. They are generally safe for breastfeeding moms, but it's always a good idea to talk to your doctor about the potential risks and benefits.
Diphenhydramine, better known as Benadryl, is a first-generation antihistamine that can provide relief from allergy symptoms. While generally considered safe for breastfeeding moms, Benadryl can cause drowsiness, both in you and potentially your baby. If you're looking for a non-drowsy antihistamine option, loratadine or Claritin is another choice to consider. It effectively relieves allergy symptoms and is generally considered safe for breastfeeding moms.
So there you have it, a crash course on medications and breastfeeding. Remember, breastfeeding is a beautiful thing, and it's amazing how our bodies are designed to nourish and protect our little ones. By understanding how medications work and making informed choices, you can continue to provide the best for your baby while taking care of yourself. If you have any concerns or questions about medications while breastfeeding, don't hesitate to reach out to your healthcare provider. Thanks for watching.